Section number 43 of Gray's Anatomy Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by M.L. Cohen. Anatomy of the Human Body Part 4 by Henry Gray. The sympathetic nerves. The sympathetic nervous system innervates all the smooth muscles and the various glands of the body and the striated muscles of the heart. The efferent sympathetic fibers, which leave the central nervous system in connection with certain of the cranial and spinal nerves, all end in sympathetic ganglia and are known as preganglionic fibers. From these ganglia, postganglionic fibers arise and conduct impulses to the different organs. In addition, afferent or sensory fibers connect many of these structures with the central nervous system. The peripheral portion of the sympathetic nervous system is characterized by the presence of numerous ganglia and complicated plexuses. These ganglia are connected with the central nervous system by three groups of sympathetic efferent or preganglionic fibers, that is, the cranial, the thoracolumbar, and the sacral. These outflows of sympathetic fibers are separated by intervals where no connections exist. The cranial and sacral sympathetics are often grouped together owing to the resemblance between the reactions produced by stimulating them and by the effects of certain drugs. Acetylcholine, for example, when injected intravenously in very small doses, produces the same effect as the stimulation of the cranial or sacral sympathetics, while the introduction of adrenaline produces the same effect as the stimulation of the thoracolumbar sympathetics. Much of our present knowledge of the sympathetic nervous system has been acquired through the application of various drugs, especially nicotine, which paralyzes connections or synapses between the preganglionic and postganglionic fibers of the sympathetic nerves. When it is injected into the general circulation, all such synapses are paralyzed. When it is applied locally on a ganglion, only the synapses occurring in that particular ganglion are paralyzed. Langley, who has contributed greatly to our knowledge, adapted a terminology somewhat different from that used here and still different from that used by the pharmacologist. This has led to considerable confusion, as shown by the arrangement of the terms in the following columns. Gaskell has used the term involuntary nervous system. Gray, sympathetic nervous system. Langley, autonomic nervous system. Meyer and Gottlieb, vegetative nervous system. Gray, craniosacral sympathetics. Langley, parasympathetics. Meyer and Gottlieb, autonomic. Gray, oculomotor sympathetics. Langley, tectal autonomics. Meyer and Gottlieb, cranial autonomics. Gray, facial sympathetics, glossopharyngeal sympathetics, vagal sympathetics. Langley, bulbar autonomics. Gray, sacral sympathetics. Langley, sacral autonomics. Meyer and Gottlieb, sacral autonomics. Gray, thoracolumbar sympathetics. Langley, sympathetic. Meyer and Gottlieb, sympathetic. Gray, enteric. Langley, thoracic autonomic and enteric. Meyer and Gottlieb, enteric. The cranial sympathetics. The cranial sympathetics include sympathetic efferent fibers in the oculomotor, facial, glossopharyngeal, and vagus nerves, as well as sympathetic afferent in the last three nerves. The sympathetic efferent fibers of the oculomotor nerve probably arise from cells in the anterior part of the oculomotor nucleus, which is located in the tegmentum of the midbrain. These preganglionic fibers run with the third nerve into the orbit and pass to the ciliary ganglion, where they terminate by forming synapses with sympathetic motor neurons whose axons, postganglionic fibers, proceed as the short ciliary nerves to the eyeball. Here they supply motor fibers to the ciliaris muscle and the sphincter pupillae muscle. So far as known, there are no sympathetic afferent fibers connected with the nerve. The sympathetic efferent fibers of the facial nerve are supposed to arise from the small cells of the facial nucleus. According to some authors, the fibers to the salivary glands arise from a special nucleus, the superior salivatory nucleus, consisting of cells scattered in a reticular formation, dorsomedial to the facial nucleus. These preganglionic fibers are distributed partly through the chorda tympani and lingual nerves to the submaxillary ganglion, where they terminate about the cell bodies of neurons whose axons as postganglionic fibers conduct secretory and vasodilatory impulses to the submaxillary and sublingual glands. Other preganglionic fibers of the facial nerve pass via the great superficial petrosal nerve to the sphenopalatine ganglion, where they form synapses with neurons whose postganglionic fibers are distributed with the superior maxillary nerve as vasodilator and secretory fibers to the mucous membranes of the nose, soft palate, tongues, uveal, roof of the mouth, upper lips and gums, parotid, and orbital glands. There are supposed to be a few sympathetic afferent fibers connected with the facial nerve, whose cell bodies lie in the geniculate ganglion, but very little is known about them. The sympathetic afferent fibers of the glossopharyngeal nerve are supposed to arise either in the dorsal nucleus, nucleus ala cinerea, or in a distinct nucleus, the inferior salivatory nucleus situated near the dorsal nucleus. These preganglionic fibers pass into the tympanic branch of the glossopharyngeal and then with the small superficial petrosal nerve to the otic ganglion. Postganglionic fibers, vasodilator, and secretory fibers are distributed to the parotid gland, to the mucous membrane and its glands on the tongue, the floor of the mouth, and the lower gums. Sympathetic afferent fibers, whose cells of origin lie in the superior or inferior ganglion of the trunk, are supposed to terminate in the dorsal nucleus. Very little is known of the peripheral distribution of these fibers. The sympathetic efferent fibers of the vagus nerve are supposed to arise in the dorsal nucleus, nucleus ala cinerea. These preganglionic fibers are all supposed to end in sympathetic ganglia situated in or near the organ supplied by the vagus sympathetics. The inhibitory fibers to the heart probably terminate in the small ganglia of the heart wall, especially the atrium, from which inhibitory postganglionic fibers are distributed to the musculature. The preganglionic motor fibers to the esophagus, the stomach, the small intestine, and the greater part of the large intestine are supposed to terminate in the plexuses of Auerbach, from which postganglionic fibers are distributed to the smooth muscles of these organs. Other fibers pass to the smooth muscles of the bronchial tree and to the gallbladder and its ducts. In addition, the vagus is believed to contain secretory fibers to the stomach and pancreas. It probably contains many other efferent fibers than those enumerated above. Sympathetic afferent fibers of the vagus, whose cells of origin lie in the jugular ganglion or the ganglion nodosum, probably terminate in the dorsal nucleus of the medulla oblongata, or according to some authors, in the nucleus of the tractus solitarius. Peripherally, the fibers are supposed to be distributed to the various organs supplied by the sympathetic efferent nerves. The sacral sympathetics. The sacral sympathetic efferent fibers leave the spinal cord with the anterior roots of the second, third, and fourth sacral nerves. These small medullated preganglionic fibers are collected together in the pelvis into the nervus erigentes, or pelvic nerve, which proceeds to the hypogastric or pelvic plexuses, from which postganglionic fibers are distributed to the pelvic viscera. Motor fibers pass to the smooth muscle of the descending colon, rectum, anus, and bladder. Vasodilators are distributed to these organs and to the external genitalia, while inhibitory fibers probably pass to the smooth muscles of the external genitalia. Afferent sympathetic fibers conduct impulses from the pelvic viscera to the second, third, and fourth sacral nerves. Their cells of origin lie in the spinal ganglia. The thoracolumbar sympathetics. The thoracolumbar sympathetic fibers arise from the dorsolateral region of the anterior column of the gray matter of the spinal cord and pass with the anterior roots of all the thoracic and upper 2 or 3 lumbar spinal nerves. These preganglionic fibers enter the white rami communicantes and proceed to the sympathetic trunk, where many of them end in its ganglia. Others pass to the prevertebral plexuses and terminate in its collateral ganglia. The postganglionic fibers have a wide distribution. The vasoconstrictor fibers to the blood vessels of the skin of the trunk and limbs, for example, leave the spinal cord as preganglionic fibers in all the thoracic and upper 2 or 3 lumbar spinal nerves and terminate in the ganglia of the sympathetic trunk, either in the ganglion directly connected with its ramus or in neighboring ganglia. Postganglionic fibers arise in these ganglia, pass through the gray rami communicantes to all the spinal nerves, and are distributed with their cutaneous branches, ultimately leaving these branches to join the small arteries. The postganglionic fibers do not necessarily return to the same spinal nerves which contain the corresponding preganglionic fibers. The vasoconstrictor fibers to the head come from the upper thoracic nerves. The preganglionic fibers end in the superior cervical ganglion. The postganglionic fibers pass through the internal carotid nerve and branch from it to join the sensory branches of the various cranial nerves, especially the trigeminal nerve. Other fibers to the deep structures and the salivary glands probably accompany the arteries. The postganglionic vasoconstrictor fibers to the blood vessels of the abdominal viscera arise in the prevertebral or collateral ganglion, in which terminate many preganglionic fibers. Vasoconstrictor fibers to the pelvic viscera arise from the inferior mesenteric ganglia. The pilomotor fibers to the hairs and the motor fibers to the sweat glands apparently have a distribution similar to that of the vasoconstrictors of the skin. A vasoconstrictor center has been located by the physiologist in the neighborhood of the facial nucleus. Axons from its cells are supposed to descend in the spinal cord to terminate about cell bodies of the preganglionic fibers located in the dorsolateral portion of the anterior column of the thoracic and upper lumbar region. The motor supply to the dilator pupillae muscle of the eye comes from preganglionic sympathetic fibers, which leave the spinal cord with the anterior roots of the upper thoracic nerves. These fibers pass to the sympathetic trunk through the white rami communicantes and terminate in the superior cervical ganglion. Postganglionic fibers from the superior cervical ganglion pass through the internal carotid nerve and into the ophthalmic division of the trigeminal nerve to the orbit, where the long ciliary nerves conduct the impulses to the eyeball and dilator pupillae muscle. The cell bodies of these preganglionic fibers are connected with fibers which descend from the midbrain. Other postganglionic fibers from the superior cervical ganglion are distributed as secretory fibers to the salivary glands, the lacrimal glands, and to the small glands of the mucous membranes of the nose, mouth, and pharynx. The thoracic sympathetics supply accelerated nerves to the heart. They are supposed to emerge from the spinal cord in the anterior roots of the upper 4 or 5 thoracic nerves and pass with the white rami to the first thoracic ganglion. Here some terminate, others pass in the ansa subclavia to the inferior cervical ganglion. The postganglionic fibers pass from these ganglia partly through the ansa subclavia to the heart. On their way, they intermingle with sympathetic fibers from the vagus to form the cardiac plexus. Inhibitory fibers to the smooth musculature of the stomach, the small intestine, and most of the large intestine are supposed to emerge in the anterior roots of the lower thoracic and upper lumbar nerves. These fibers pass through the white rami and sympathetic trunk and are conveyed by the splanchnic nerves to the prevertebral plexus, where they terminate in the collateral ganglia. From the celiac and superior mesenteric ganglia, postganglionic fibers, inhibitory, are distributed to the stomach, the small intestine, and most of the large intestine. Inhibitory fibers to the descending colon, the rectum, and the internal sphincter ani are probably postganglionic fibers from the inferior mesenteric ganglion. The thoracolumbar sympathetics are characterized by the presence of numerous ganglia, which may be divided into 2 groups, central and collateral. The central ganglia are arranged in 2 vertical rows, one on either side of the midline, situated partly in front and partly at the sides of the vertebral column. Each ganglion is joined by intervening nervous cords to adjacent ganglia, so that 2 chains, the sympathetic trunks, are formed. The collateral ganglia are found in connection with the 3 great prevertebral plexuses placed within the thorax, abdomen, and pelvis, respectively. The sympathetic trunks, truncus sympatheticus, gangliated cord, extend from the base of the skull to the coccyx. The cephalic end of each is continued upward through the carotid canal into the skull and forms a plexus on the internal carotid artery. The caudal ends of the trunk converge and end in a single ganglion, the ganglion impar, placed in front of the coccyx. The ganglia of each trunk are distinguished as cervical, thoracic, lumbar, and sacral, and, except in the neck, they are closely correspond in number to the vertebrae. They are arranged thus: cervical portion, 3 ganglia; thoracic portion, 12 ganglia; lumbar portion, 4 ganglia; sacral portion, 4 or 5 ganglia. In the neck, the ganglia lie in front of the transverse processes of the vertebrae. In the thoracic region, in front of the heads of the ribs; in the lumbar region, on the sides of the vertebral bodies; and in the sacral region, in front of the sacrum. Connection with the spinal nerves. Communications are established between the sympathetic and spinal nerves through what are known as gray and white rami communicantes. The gray rami convey sympathetic fibers to the spinal nerves, and the white rami transmit spinal fibers to the sympathetic. Each spinal nerve receives a gray ramus communicans from the sympathetic trunk, but white rami are not supplied by all the spinal nerves. White rami are derived from the first thoracic to the first lumbar nerves inclusive, while the visceral branches which run from the second, third, and fourth sacral nerves directly to the pelvic plexuses of the sympathetic belong to this category. The fibers which reach the sympathetic through the white rami communicantes are medullated. Those which spring from the cells of the sympathetic ganglia are almost entirely non-medullated. The sympathetic nerves consist of efferent and afferent fibers, the origin and course of which are described subsequently. The three great gangliated plexuses, collateral ganglia, are situated in front of the vertebral column in the thoracic, abdominal, and pelvic regions, and are named respectively the cardiac, the solar or epigastric, and the hypogastric plexuses. They consist of collection of nerves and ganglia, the nerve being derived from the sympathetic trunks and from the cerebrospinal nerves. They distribute branches to the viscera. Development. The ganglion cells of the sympathetic system are derived from the cells of the neural crests. As these crests move forward along the sides of the neural tube and become segmented off to form the spinal ganglia, certain cells detach themselves from the ventral margins of the crests and migrate towards the sides of the aorta. Some of them are grouped to form the ganglia of the sympathetic trunks, while others undergo a further migration and form the ganglia of the prevertebral and visceral plexuses. The ciliary, sphenopalatine, otic, and submaxillary ganglia, which are found on the branches of the trigeminal nerve, are formed by groups of cells which have migrated from part of the neural crest, which gives rise to the semilunar ganglion. Some of the cells of the ciliary ganglion are said to migrate from the neural tube along the oculomotor nerve. End of section 43. Of Gray's Anatomy Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording from M.L. Cohen, Anatomy of the Human Body Part 4 by Henry Gray, the cephalic and cervical portions of the sympathetic system. The cephalic portion of the sympathetic system. Pars cephalica, S. sympathesi. The cephalic portion of the sympathetic system begins as the internal carotid nerve, which appears to be a direct prolongation of the superior cervical ganglion. It is soft in texture and of a reddish color. It ascends by the side of the internal carotid artery, and entering the carotid canal in the temporal bone, divides into two branches, which lie one on the lateral and the other on the medial side of that vessel. The lateral branch, the larger of the two, distributes filaments to the internal carotid artery and forms the internal carotid plexus. The medial branch also distributes filaments to the internal carotid artery and, continuing onward, forms the cavernous plexus. The internal carotid plexus, plexus caroticus interneus, carotid plexus, is situated on the lateral side of the internal carotid artery, and in the plexus there occasionally exists a small gangliform swelling, the carotid ganglion, on the undersurface of the artery. The internal carotid plexus communicates with the semilunar ganglion, the abducent nerve, and the sphenopontine ganglion. It distributes filaments to the wall of the carotid artery and also communicates with the tympanic branch of the glossopharyngeal nerve. The communicating branches with the abducent nerve consist of one or two filaments which join that nerve as it lies upon the lateral side of the internal carotid artery. The communication with the sphenopalatine ganglion is effected by a branch, the deep petrosal, given off from the plexus on the lateral side of the artery. This branch passes through the cartilage, filling up the foramen lacerum, and joins the gradal superficial petrosal to form the nerve of the pterygoid canal, Vidian nerve, which passes through the pterygoid canal to the sphenopontine ganglion. Communication with the tympanic branch of the glossopharyngeal nerve is effected by the corticotympanic, which may consist of 2 or 3 delicate filaments. The cavernous plexus, plexus cavernosus, is situated below and medial to that part of the internal carotid artery which is placed by the side of the sella turcica in the cavernous sinus and is formed chiefly by the medial division of the internal carotid nerve. It communicates with the oculomotor, the trochlear, the ophthalmic, and the abducent nerves, and with the ciliary ganglion, and distributes filaments to the wall of the internal carotid artery. The branch of communication with the oculomotor nerve joins that nerve at its point of division. The branch to the trochlear nerve joins it as it lies on the lateral wall of the cavernous sinus. Other filaments are connected with the undersurface of the ophthalmic nerve, and the second filament joins the abducent nerve. The filaments of connection with the ciliary ganglion arise from the anterior part of the cavernous plexus and enter the orbit through the superior orbital fissure. They may join the nasociliary branch of the ophthalmic nerve or be continued forward as a separate branch. The terminal filaments from the internal carotid and cavernous plexuses are prolonged as plexuses around the anterior and middle cerebral arteries and the ophthalmic artery. Along the formal vessels, they may be traced to the pia mater. Along the latter, into the orbit, where they accompany each of the branches of the vessel. The filaments prolonged on to the anterior communicating artery connect the sympathetic nerves of the right and left sides. The cervical portion of the sympathetic system. Pars cervicalis, S. sympathesi. The cervical portion of the sympathetic trunk consists of 3 ganglia, distinguished according to positions as the superior, middle, and inferior ganglia, connected by intervening cords. This portion receives no white rami communicantes from the cervical spinal nerves. Its spinal fibers are derived from the white rami of the upper thoracic nerves and enter the corresponding thoracic ganglia of the sympathetic trunk, through which they ascend into the neck. The superior cervical ganglion, ganglion cervicalis superioris, the largest of the 3, is placed opposite the second and third cervical vertebrae. It is of reddish-gray color and usually fusiform in shape, sometimes broad and flattened, and occasionally constricted at intervals. It is believed to be formed by the coalescence of 4 ganglia, corresponding to the upper 4 cervical nerves. It is in relation in front with the sheath of the internal carotid artery and internal jugular vein, behind with the longest capitis muscle. Its branches may be divided into inferior, lateral, medial, and anterior. The inferior branch communicates with the middle cervical ganglion. The lateral branches, external branches, consist of gray rami communicantes to the upper 4 cervical nerves and to certain of the cranial nerves. Sometimes the branch to the 4th cervical nerve may come from the trunk connecting the upper and middle cervical ganglia. The branches to the cranial nerves consist of delicate filaments which run to the ganglion nodosum of the vagus and to the hypoglossal nerve. A filament, the jugular nerve, passes upward to the base of the skull and divides to join the petrous ganglion of the glossopharyngeal and the jugular ganglion of the vagus. The medial branches, internal branches, are peripheral and are the laryngopharyngeal branches and the superior cardiac nerve. The laryngopharyngeal branches, rami laryngopharyngii, pass to the sides of the pharynx, where they join with branches from the glossopharyngeal vagus and external laryngeal nerves to form the pharyngeal plexus. The superior cardiac nerve, nervus cardiacus superior, arises by 2 or more branches from the superior cervical ganglion and occasionally receives a filament from the trunk between the 1st and 2nd cervical ganglia. It runs down the neck behind the common carotid artery and in front of the longus colli muscle, and crosses in front of the inferior thyroid artery and recurrent nerve. The course of the nerves on the 2 sides then differ. The right nerve, at the root of the neck, passes either in front of or behind the subclavian artery, and along the innominate artery to the back of the arch of the aorta, where it joins the deep part of the cardiac plexus. It is connected with other branches of the sympathetic. About the middle of the neck, it receives filaments from the external laryngeal nerve, lower down, 1 or 2 twigs from the vagus, and as it enters the thoracic, it is joined by a filament from the recurrent nerve. Filaments from the nerve communicate with the thyroid branches from the middle cervical ganglion. The left nerve, in the thorax, runs in front of the left common carotid artery and across the left side of the arch of the aorta to the superficial part of the cardiac plexus. The anterior branches, nervus carotici externi, ramify upon the common carotid artery and upon the external carotid artery and its branches, forming around each a delicate plexus, on the nerves composing which small ganglia are occasionally found. The plexuses accompanying some of these arteries have important communications with other nerves. That surrounding the external maxillary artery communicates with the submaxillary ganglion by a filament, and that accompanying the middle meningeal artery sends an offset to the otic ganglia, and a second, the external petrosal nerve, to the genicular ganglion of the facial nerve. The middle cervical ganglion, ganglion cervicali medium, is the smallest of the 3 cervical ganglia, and is occasionally wanting. It is placed opposite the 6 cervical vertebrae, usually in front of or close to the inferior thyroid artery. It is probably formed by the coalescence of 2 ganglia corresponding to the 5th and 6th cervical nerves. It sends gray rami communicantes to the 5th and 6th cervical nerves and gives off the middle cardiac nerve. The middle cardiac nerve, nerve cardiacus medius, great cardiac nerve, is the largest of the 3 cardiac nerves, arises from the middle cervical ganglion or from the trunk between the middle and inferior ganglia. On the right side, it descends behind the common carotid artery and at the root of the neck runs either in front of or behind the subclavian artery. It then descends on the trachea, receives a few filaments from the recurrent nerve, and joins the right half of the deep part of the cardiac plexus. In the neck, it communicates with the superior cardiac and recurrent nerves. On the left side, the middle cardiac nerve enters the chest between the left carotid and subclavian arteries and joins the left half of the deep part of the cardiac plexus. The inferior cervical ganglion, ganglion cervicali inferius, is situated between the base of the transverse process of the last cervical vertebra and the neck of the first rib on the medial side of the costocervical artery. Its form is irregular. It is larger in size than the preceding and is frequently fused with the first thoracic ganglion. It is probably formed by the coalescence of 2 ganglia, which correspond to the 7th and 8th cervical nerves. It is connected to the middle cervical ganglion by 2 or more cords, one of which forms a loop around the subclavian artery and supplies offsets to it. This loop is named ansa subclavia, Viesene. The ganglion sends gray rami communicantes to the 7th and 8th cervical nerves. It gives off the inferior cardiac nerve and offsets to blood vessels. The inferior cardiac nerve, nervus cardiacus inferior, arise from either the inferior cervical or the first thoracic ganglion. It descends behind the subclavian artery and along the front of the trachea to join the deep part of the cardiac plexus. It communicates freely behind the subclavian artery with the recurrent nerve and the middle cardiac nerve. The offsets to blood vessels form plexuses on the subclavian artery and its branches. The plexus on the vertebral artery is continued on to the basilar, posterior cerebral, and cerebellar arteries. The plexus on the inferior thyroid artery accompanies the artery to the thyroid gland and communicates with the recurrent and external laryngeal nerves, with the superior cardiac nerve, and with the plexus on the common carotid artery. End of section 44.
Of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit thelibrivox.org. Recording by David Lawrence. Anatomy of the Human Body, Part 4, by Henry Gray. 7c. The thoracic portion of the sympathetic system. Pars thoracalis est sympathesi. The thoracic portion of the sympathetic trunk consists of a series of ganglia, which usually correspond in number to that of the vertebrae, but, on account of the occasional coalescence of 2 ganglia, their number is uncertain. The thoracic ganglia rest against the heads of the ribs, and are covered by the costal pleura. The last 2, however, are more anterior than the rest, and are placed on the sides of the bodies of the 11th and 12th thoracic vertebrae. The ganglia are small in size and of a grayish color. The first, larger than the others, is of an elongated form, and frequently blended with the inferior cervical ganglion. They are connected together by the intervening portions of the trunk. 2 rami communicantes, a white and a gray, connect each ganglia with its corresponding spinal nerve. The branches from the upper 5 ganglia are very small. They supply filaments to the thoracic artery and its branches. Twigs from the 2nd, 3rd, and 4th ganglia enter the posterior pulmonary plexus. The branches from the lower 7 ganglia are large and white in color. They distribute filaments to the aorta and unite to form the greater, the lesser, and the lowest splanchnic nerves. The greater splanchnic nerve, N. splanchnicus major, great splanchnic nerve, is white in color, firm in texture, and of a considerable size. It is formed by branches from the 5th to the 9th or 10th thoracic ganglia. but the fibers in the higher roots may be traced upward in the sympathetic trunk as far as the first or second thoracic ganglion. It descends obliquely on the bodies of the vertebrae, perforates the crust of the diaphragm, and ends in the celiac ganglion. A ganglion, ganglion splanchnicum, exists on this nerve opposite the 11th or 12th thoracic vertebra. The lesser splanchnic nerve, N. splanchnicus minor, is formed by filaments from the 9th and 10th, and sometimes the 11th thoracic ganglia, and from the cord between them. It pierces the diaphragm with the preceding nerve and joins the aorticorenal ganglion. The lower splanchnic nerve, splanchnicus immus, least splanchnic nerve, arises from the last thoracic ganglion, and, piercing the diaphragm, ends in the renal plexus. A striking analogy exists between the splanchnic and the cardiac nerves. The cardiac nerves are 3 in number. They arise from all 3 cervical ganglia, and are distributed to a large and important organ in the thoracic cavity. The splanchnic nerves, also 3 in number, are connected probably with all the thoracic ganglia, and are distributed to important organs in the abdominal cavity. 7d. The abdominal portion of the sympathetic system. Pars abdominalis est sympathetici, lumbar portion of ganglionated cord. The abdominal portion of the sympathetic trunk is situated in front of the vertebral column, along the medial margin of the psoas major. It consists usually of 4 lumbar ganglia, connected together by interganglionic cords. It is continuous above with the thoracic portion beneath the medial lumbocostal arch, and below with the pelvic portion behind the common iliac artery. The ganglia are of small size and placed much nearer the median line than are the thoracic ganglia. Gray rami communicantes pass from all the ganglia to the lumbar spinal nerves. The first and second, and sometimes the third, lumbar nerves send white rami communicantes to the corresponding ganglia. The rami communicantes are of considerable length, and accompany the lumbar arteries around the sides of the bodies of the vertebrae, passing beneath the fibrous arches from which some of the fibers of the psoas major arise. Of the branches of distribution, some pass in front of the aorta and join the aortic plexus. Others descend in front of the common iliac arteries and assist in forming the hypogastric plexus. 7e. The pelvic portion of the sympathetic system. Pars pelvina est sympathetici. The pelvic portion of each sympathetic trunk is situated in front of the sacrum, medial to the anterior sacral foramina. It consists of 4 or 5 small sacral ganglia, connected together by interganglionic cords, and continuous above with the abdominal portion. Below, the 2 pelvic sympathetic trunks converge, and end on the front of the coccyx, in a small ganglion, the ganglion impar. Gray rami communicantes pass from the ganglia to the sacral and the coccygeal nerves. No white rami communicantes are given to this part of the ganglionated cord, but the visceral branches which arise from the 3rd and 4th, and sometimes from the 2nd, sacral, and run directly to the pelvic plexuses, are regarded as the white rami communicantes. The branches of distribution communicate on the front of the sacrum with the corresponding branches from the opposite side. Some, from the first 2 ganglia, pass to join the pelvic plexus, and others form a plexus which accompanies the middle sacral artery and sends filaments to the glomus coccygeum, coccygeal body. End of section 45. Recording by David Lawrence, October 2009, in Brampton, Ontario.
Section 46 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Bologna Times. Anatomy of the Human Body, Part 4, by Henry Gray. The Great Plexuses of the Sympathetic System. The great plexuses of the sympathetic are aggregations of nerves and ganglia, situated in the thoracic, abdominal, and pelvic cavities, and named the cardiac, celiac, and hypogastric plexuses. They consist not only of sympathetic fibers derived from the ganglia, but of fibers from the medulla spinalis, which are conveyed through the white rami communicantes. From the plexuses branches are given to the thoracic, abdominal, and pelvic viscera. The cardiac plexus, plexus cardiacus. The cardiac plexus is situated at the base of the heart, and is divided into a superficial part which lies in the concavity of the aortic arch, and a deep part between the aortic arch and the trachea. The two parts are, however, closely connected. The superficial part of the cardiac plexus lies beneath the arch of the aorta, in front of the right pulmonary artery. It is formed by the superior cardiac branch of the left sympathetic and the lower superior cervical cardiac branch of the left vagus. A small ganglion, the cardiac ganglion of Risberg, is occasionally found connected with these nerves at their point of junction. This ganglion, when present, is situated immediately beneath the arch of the aorta, on the right side of the ligamentum arteriosum. The superficial part of the cardiac plexus gives branches A to the deep part of the plexus, B to the anterior coronary plexus, and C to the left anterior pulmonary plexus. The deep part of the cardiac plexus is situated in front of the bifurcation of the trachea, above the point of division of the pulmonary artery, and behind the aortic arch. It is formed by the cardiac nerves derived from the cervical ganglia of the sympathetic and the cardiac branches of the vagus and recurrent nerves. The only cardiac nerves which do not enter into the formation of the deep part of the cardiac plexus are the superior cardiac nerve of the left sympathetic and the lower of the two superior cervical cardiac branches from the left vagus, which pass to the superficial part of the plexus. The branches from the right half of the deep part of the cardiac plexus pass, some in front of and others behind, the right pulmonary artery. The former, the more numerous, transmit a few filaments to the anterior pulmonary plexus, and are then continued onward to form part of the anterior coronary plexus. Those behind the pulmonary artery distribute a few filaments to the right atrium, and are then continued onward to form part of the posterior coronary plexus. The left half of the deep part of the plexus is connected with the superficial part of the cardiac plexus, and gives filaments to the left atrium and to the anterior pulmonary plexus, and is then continued to form the greater part of the posterior coronary plexus. The posterior coronary plexus, plexus coronarius posterior, left coronary plexus, is larger than the anterior, and accompanies the left coronary artery. It is chiefly formed by filaments prolonged from the left half of the deep part of the cardiac plexus, and by a few from the right half. It gives branches to the left atrium and ventricle. The anterior coronary plexus, plexus coronarius anterior, right coronary plexus, is formed partly from the superficial and partly from the deep parts of the cardiac plexus. It accompanies the right coronary artery, and gives branches to the right atrium and ventricle. The celiac plexus, plexus coeliacus, solar plexus. The celiac plexus, the largest of the three sympathetic plexuses, is situated at the level of the upper part of the first lumbar vertebra, and is composed of two large ganglia, the celiac ganglia, and a dense network of nerve fibers uniting them together. It surrounds the celiac artery and the root of the superior mesenteric artery. It lies behind the stomach and the omental bursa, in front of the crura of the diaphragm and the commencement of the abdominal aorta, and between the suprarenal glands. The plexus and the ganglia receive the greater and lesser splanchnic nerves of both sides and some filaments from the right vagus, and give off numerous secondary plexuses along the neighboring arteries. The celiac ganglia, ganglia celiaca, semilunar ganglia, are two large, irregularly shaped masses having the appearance of lymph glands and placed one on either side of the middle line in front of the crura of the diaphragm, close to the suprarenal glands, that on the right side being placed behind the inferior vena cava. The upper part of each ganglion is joined by the greater splanchnic nerve, while the lower part, which is segmented off and named the aorticorenal ganglion, receives the lesser splanchnic nerve and gives off the greater part of the renal plexus. The secondary plexuses springing from or connected with the celiac plexus are the phrenic, renal, hepatic, spermatic, lenal, superior mesenteric, superior gastric, abdominal aortic, suprarenal, inferior mesenteric. The phrenic plexus, plexus phrenicus, accompanies the inferior phrenic artery to the diaphragm, some filaments passing to the suprarenal gland. It arises from the upper part of the celiac ganglion, and is larger on the right than on the left side. It receives one or two branches from the phrenic nerve. At the point of junction of the right phrenic plexus with the phrenic nerve is a small ganglion, ganglion phrenicum. This plexus distributes branches to the inferior vena cava and to the suprarenal and hepatic plexuses. The hepatic plexus, plexus hepaticus, the largest offset from the celiac plexus, receives filaments from the left vagus and right phrenic nerves. It accompanies the hepatic artery, ramifying upon its branches and upon those of the portal vein in the substance of the liver. Branches from this plexus accompany all the divisions of the hepatic artery. A considerable plexus accompanies the gastroduodenal artery, and is continued as the inferior gastric plexus on the right gastroepiploic artery along the greater curvature of the stomach, where it unites with offshoots from the lenal plexus. The lenal plexus, plexus lenalis, splenic plexus, is formed by branches from the celiac plexus, the left celiac ganglion, and from the right vagus nerve. It accompanies the lenal artery to the spleen, giving off, in its course, subsidiary plexuses along the various branches of the artery. The superior gastric plexus, plexus gastricus superior, gastric or coronary plexus, accompanies the left gastric artery along the lesser curvature of the stomach, and joins with branches from the left vagus. The suprarenal plexus, plexus suprarenalis, is formed by branches from the celiac plexus, from the celiac ganglion, and from the phrenic and greater splanchnic nerves, a ganglion being formed at the point of junction with the latter nerve. The plexus supplies the suprarenal gland, being distributed chiefly to its medullary portion. Its branches are remarkable for their large size in comparison with that of the organ they supply. The renal plexus, plexus renalis, is formed by filaments from the celiac plexus, the aorticorenal ganglion, and the aortic plexus. It is joined also by the smallest splanchnic nerve. The nerves from these sources, 15 or 20 in number, have a few ganglia developed upon them. They accompany the branches of the renal artery into the kidney. Some filaments are distributed to the spermatic plexus and, on the right side, to the inferior vena cava. The spermatic plexus, plexus spermaticus, is derived from the renal plexus, receiving branches from the aortic plexus. It accompanies the internal spermatic artery to the testes. In the female, the ovarian plexus, plexus arteriae ovaricae, arises from the renal plexus and is distributed to the ovary and fundus of the uterus. The superior mesenteric plexus, plexus mesentericus superior, is a continuation of the lower part of the celiac plexus, receiving a branch from the junction of the right vagus nerve with the plexus. It surrounds the superior mesenteric artery, accompanies it into the mesentery, and divides into a number of secondary plexuses, which are distributed to all parts supplied by the artery, viz., pancreatic branches to the pancreas, intestinal branches to the small intestine, and ileocolic, right colic, and middle colic branches, which supply the corresponding parts of the great intestine. The nerves composing this plexus are white in color and firm in texture. In the upper part of the plexus, close to the origin of the superior mesenteric artery, is a ganglion, ganglion mesentericum superius. The abdominal aortic plexus, plexus aorticus abdominalis, aortic plexus, is formed by branches derived on either side from the celiac plexus and ganglia, and receives filaments from some of the lumbar ganglia. It is situated upon the sides and front of the aorta, between the origins of the superior and inferior mesenteric arteries. From this plexus arise part of the spermatic, the inferior mesenteric, and the hypogastric plexuses. It also distributes filaments to the inferior vena cava. The inferior mesenteric plexus, plexus mesentericus inferior, is derived chiefly from the aortic plexus. It surrounds the inferior mesenteric artery and divides into a number of secondary plexuses which are distributed to all the parts supplied by the artery, viz., the left colic and sigmoid plexuses, which supply the descending and sigmoid parts of the colon, and the superior hemorrhoidal plexus, which supplies the rectum and joins in the pelvis with branches from the pelvic plexuses. The hypogastric plexus, plexus hypogastricus. The hypogastric plexus is situated in front of the last lumbar vertebra and the promontory of the sacrum, between the two common iliac arteries, and is formed by the union of numerous filaments which descend on either side from the aortic plexus and from the lumbar ganglia. It divides below into two lateral portions, which are named the pelvic plexuses. The pelvic plexuses. The pelvic plexuses supply the viscera of the pelvic cavity and are situated at the sides of the rectum in the male and at the sides of the rectum and vagina in the female. They are formed on either side by a continuation of the hypogastric plexus, by the sacral sympathetic efferent fibers from the second, third, and fourth sacral nerves, and by a few filaments from the first two sacral ganglia. At the points of junction of these nerves, small ganglia are found. From these plexuses numerous branches are distributed to the viscera of the pelvis. They accompany the branches of the hypogastric artery. The middle hemorrhoidal plexus, plexus hemorrhoidal medius, arises from the upper part of the pelvic plexus. It supplies the rectum and joins the branches of the superior hemorrhoidal plexus. The vesical plexus, plexus vesicalis, arises from the forepart of the pelvic plexus. The nerves composing it are numerous, and contain a large proportion of spinal nerve fibers. They accompany the vesical arteries, and are distributed to the sides and fundus of the bladder. Numerous filaments also pass to the vesiculae seminales and ductus deferens. Those accompanying the ductus deferens join on the spermatic cord with branches from the spermatic plexus. The prostatic plexus, plexus prostaticus, is continued from the lower part of the pelvic plexus. The nerves composing it are of large size. They are distributed to the prostate vesiculae and the corpora cavernosa of the penis and urethra. The nerves supplying the corpora cavernosa consist of two sets, the lesser and greater cavernous nerves, which arise from the forepart of the prostatic plexus and, after joining with branches from the pudendal nerve, pass forward beneath the pubic arch. The lesser cavernous nerves, cavernosae penis minoris, small cavernous nerves, perforate the fibrous covering of the penis near its root. The greater cavernous nerve, cavernosus penis major, large cavernous plexus, passes forward along the dorsum of the penis, joins with the dorsal nerve of the penis, and is distributed to the corpora cavernosa. The vaginal plexus arises from the lower part of the pelvic plexus. It is distributed to the walls of the vagina, to the erectile tissue of the vestibule, and to the clitoris. The nerves composing this plexus contain, like the vesicle, a large proportion of spinal nerve fibers. The uterine plexus accompanies the uterine artery to the side of the uterus, between the layers of the broad ligament. It communicates with the ovarian plexus. End of section 46.
Section 47 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by David Lawrence. Anatomy of the Human Body, Part 4, by Henry Gray. The organs of the senses and the common integument. The organs of the senses may be divided into a. Those of the special senses of taste, smell, sight, and hearing, and b. Those associated with the general sensations of heat, cold, pain, pressure, etc. 1. The peripheral organs of the special senses. a. The organs of taste. Organon gustus. The peripheral gustatory or taste organs consist of certain modified epithelial cells arranged in flask-shaped groups termed gustatory caliculi, taste buds, which are found on the tongue and adjacent parts. They occupy nests in the stratified epithelium and are present in large numbers on the sides of the papillae velati, and to a less extent on their opposed walls. They are also found on the fungiform papillae over the back part and sides of the tongue, and in the general epithelial covering of the same areas. They are very plentiful over the fimbriae linguae, and are also present on the under surface of the soft palate, and on the posterior surface of the epiglottis. Structure. Each taste bud is flask-like in shape, its broad base resting on the corium, and its neck opening by an orifice, the gustatory pore, between the cells of the epithelium. The bud is formed by two kinds of cells, supporting cells and gustatory cells. The supporting cells are mostly arranged like the staves of a cask, and form an outer envelope for the bud. Some, however, are found in the interior of the bud between the gustatory cells. The gustatory cells occupy the central portion of the bud. They are spindle-shaped, and each possesses a large spherical nucleus near the middle of the cell. The peripheral end of the cell terminates at the gustatory pore in a fine hair-like filament, the gustatory hair. The central process passes toward the deep extremity of the bud, and there ends in single or bifurcated varicosities. The nerve fibrils, after losing their medullary sheaths, enter the taste bud and end in fine extremities between the gustatory cells. Other nerve fibrils ramify between the supporting cells and terminate in fine extremities. These, however, are believed to be the nerves of ordinary sensation and not gustatory. Nerves of taste. The chorda tympani nerve, derived from the sensory root of the facial, is the nerve of taste for the anterior 2/3 of the tongue. The nerve for the posterior third is the glossopharyngeal. End of section 47. Recording by David Lawrence in Brampton, Ontario, September 2009.
Of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Anatomy of the Human Body, Part 4, by Henry Gray. The organ of smell. Organon olfactorius, the nose. The peripheral olfactory organ, or organ of smell, consists of two parts: an outer, the external nose, which projects from the center of the face, and an internal, the nasal cavity, which is divided by a septum into right and left nasal chambers. The external nose, nasus externus, outer nose. The external nose is pyramidal in form, and its upper angle or root is connected directly with the forehead. Its free angle is termed the apex. Its base is perforated by two elliptical orifices, the nares, separated from each other by an antero-posterior septum, the columna. The margins of the nares are provided with a number of stiff hairs, or vibrissae, which arrest the passage of foreign substances carried with the current of air intended for respiration. The lateral surfaces of the nose form, by their union in the middle line, the dorsum nasi, the direction of which varies considerably in different individuals. The upper part of the dorsum is supported by the nasal bones and is named the bridge. The lateral surface ends below in a rounded eminence, the ala nasi. Structure. The framework of the external nose is composed of bones and cartilages. It is covered by the integument and lined by mucous membrane. The bony framework occupies the upper part of the organ. It consists of the nasal bones and the frontal processes of the maxillae. The cartilaginous framework, cartilaginous nasi, consists of 5 large pieces, namely the cartilage of the septum, the 2 lateral and the 2 greater alar cartilages, and several smaller pieces, the lesser alar cartilages. The various cartilages are connected to each other and to the bones by a tough fibrous membrane. The cartilage of the septum, cartilagio septi nasi, is somewhat quadrilateral in form, thicker at its margins than at its center, and completes the separation between the nasal cavities in front. Its anterior margin, thickest above, is connected with the nasal bones, and is continuous with the anterior margins of the lateral cartilages. Below it is connected to the medial crura of the greater alar cartilages by fibrous tissue. Its posterior margin is connected with the perpendicular plate of the ethmoid, its inferior margin with the vomer and the palatine processes of the maxillae. It may be prolonged backward, especially in children, as a narrow process, the sphenoidal process, for some distance between the vomer and the perpendicular plate of the ethmoid. The septal cartilage does not reach as far as the lowest part of the nasal septum. This is formed by the medial crura of the greater alar cartilages and by the skin. It is freely movable, and hence is termed the septum mobile nasi. The lateral cartilage, cartilagio nasi lateralis, upper lateral cartilage, is situated below the inferior margin of the nasal bone, and is flattened and triangular in shape. Its anterior margin is thicker than the posterior, and is continuous above with the cartilage of the septum, but separated from it below by a narrow fissure. Its superior margin is attached to the nasal bone and the frontal process of the maxilla. Its inferior margin is connected by fibrous tissue with the greater alar cartilage. The greater alar cartilage, cartilagio alaris major, lower lateral cartilage, is a thin, flexible plate, situated immediately below the preceding, and bent upon itself in such a manner as to form the medial and lateral walls of the nares of its own side. The portion which forms the medial wall, crus mediale, is loosely connected with the corresponding portion of the opposite cartilage. the two forming, together with the thickened integument and subadjacent tissue, the septum mobile nasi. The part which forms the lateral wall, crus laterale, is curved to correspond with the ala of the nose. It is oval and flattened, narrow behind, where it is connected with the frontal process of the maxilla by a tough fibrous membrane, in which are found 3 or 4 small cartilaginous plates, the lesser alar cartilages, cartilagines alaris minores, sesamoid cartilages. Above it is connected by fibrous tissue to the lateral cartilage and front part of the cartilage of the septum. Below it falls short of the margin of the nares, the ala being completed by fatty and fibrous tissue covered by skin. In front, the greater alar cartilages are separated by a notch, which corresponds with the apex of the nose. The muscles acting on the external nose have been described in the section on myology. The integument of the dorsum and sides of the nose is thin, and loosely connected with the subadjacent parts, but over the tip and alae it is thicker and more firmly adherent, and is furnished with a larger number of sebaceous follicles, the orifices of which are usually very distinct. The arteries of the external nose are the alar and septal branches of the external maxillary, which supply the alae and septum, the dorsum and sides being supplied from the dorsal nasal branch of the ophthalmic and the infraorbital branch of the internal maxillary. The veins end in the anterior facial and ophthalmic veins. The nerves for the muscles of the nose are derived from the facial, while the skin receives branches from the infratrochlear and nasociliary branches of the ophthalmic and from the infraorbital of the maxillary. The nasal cavity, cavum nasi, nasal fossa. The nasal chambers are situated one on either side of the median plane. They open in front through the nares, and communicate behind through the choanae with the nasal part of the pharynx. The nares are somewhat pear-shaped apertures, each measuring about 2.5 centimeters antero-posteriorly and 1.25 centimeters transversely at its widest part. The choanae are 2 oval openings, each measuring 2.5 centimeters in the vertical and 1.25 centimeters in the transverse direction in a well-developed adult skull. For the description of the bony boundaries of the nasal cavity, see pages 194 and 195. Inside the aperture of the nostril is a slight dilation, the vestibule, bounded laterally by the ala and lateral crus of the greater alar cartilage, and medially by the medial crus of the same cartilage. It is lined by skin containing hairs and sebaceous glands, and extends as a small recess toward the apex of the nose. Each nasal cavity, above and behind the vestibule, is divided into 2 parts, an olfactory region consisting of the superior nasal concha and the opposed part of the septum, and a respiratory region which comprises the rest of the cavity. Lateral wall. On the lateral wall are the superior, middle, and inferior nasal conchae, and below and lateral to each concha is the corresponding nasal passage or meatus. Above the superior concha is a narrow recess, the sphenoethmoidal recess, into which the sphenoidal sinus opens. The superior meatus is a short oblique passage extending about halfway along the upper border of the middle concha. The posterior ethmoidal cells open into the front part of this meatus. The middle meatus is below and lateral to the middle concha, and is continued anteriorly into a shallow depression, situated above the vestibule and named the atrium of the middle meatus. On raising or removing the middle concha, the lateral wall of this meatus is fully displayed. On it is a rounded elevation, the bulla ethmoidalis, and below and in front of this a curved cleft, the hiatus semilinearis. The bulla ethmoidalis is caused by the bulging of the middle ethmoidal cells which open on or immediately above it, and the size of the bulla varies with that of its contained cells. The hiatus semilinearis is bounded inferiorly by the sharp concave margin of the uncinate process of the ethmoid bone, and leads into a curved channel, the infundibulum, bounded above by the bulla ethmoidalis, and below by the lateral surface of the uncinate process of the ethmoid. The anterior ethmoidal cells open into the front part of the infundibulum, and this, in slightly over 50% of subjects, is directly continuous with the frontonasal duct or passage leading from the frontal air sinus. But when the anterior end of the uncinate process fuses with the front part of the bulla, This continuity is interrupted, and the frontonasal duct then opens directly into the anterior end of the middle meatus. Below the bulla ethmoidalis, and partly hidden by the inferior end of the uncinate process, is the ostium maxillaire, or opening from the maxillary sinus. In a frontal section, this opening is seen to be placed near the roof of the sinus. An accessory opening from the sinus is frequently present below the posterior end of the middle nasal concha. The inferior meatus is below and lateral to the inferior nasal concha. The nasolacrimal duct opens into this meatus under cover of the anterior part of the inferior concha. Medial wall. The medial wall or septum is frequently more or less deflected from the median plane, thus lessening the size of one nasal cavity and increasing that of the other. Ridges or spurs of bone growing into one or other cavity from the septum are also sometimes present. Immediately over the incisive canal at the lower edge of the cartilage of the septum, a depression, the nasopalatine recess, is seen. In the septum, close to this recess, a minute orifice may be discerned. It leads backward into a blind pouch, the rudimentary vomeronasal organ of Jacobson, which is supported by a strip of cartilage, the vomeronasal cartilage. This organ is well developed in many of the lower animals, where it apparently plays a part in the sense of smell, since it is supplied by twigs of the olfactory nerve and lined by epithelium similar to that in the olfactory region of the nose. The roof of the nasal cavity is narrow from side to side, except at its posterior part, and may be divided, from behind forward, into sphenoidal, ethmoidal, and frontonasal parts, after the bones which form it. The floor is concave from side to side, and almost horizontal antero-posteriorly. Its anterior 3/4 are formed by the palatine process of the maxilla, its posterior fourth by the horizontal process of the palatine bone. In its anteromedial part, directly over the incisive foramen, a small depression, the nasopalatine recess, is sometimes seen. It points downward and forward, and occupies the position of a canal which connected the nasal with the buccal cavity in early fetal life. The mucous membrane, membrana mucosa nasi. The nasal mucous membrane lines the nasal cavities, and is intimately adherent to the periosteum or perichondrium. It is continuous with the skin through the nares, and with the mucous membrane of the nasal part of the pharynx through the choanae. From the nasal cavity its continuity with the conjunctiva may be traced, through the nasolacrimal and lacrimal ducts, and with the frontal, ethmoidal, sphenoidal, and maxillary sinuses through the several openings in the meatuses. The mucous membrane is thickest and most vascular over the nasal conchae. It is also thick over the septum, but it is very thin in the meatuses, on the floor of the nasal cavities, and in the various sinuses. Owing to the thickness of the greater part of this membrane, the nasal cavities are much narrower, and the middle and inferior nasal conchae appear larger and more prominent than in the skeleton. Also the various apertures communicating with the meatuses are considerably narrowed. Structure of the mucous membrane. The epithelium covering the mucous membrane differs in its character according to the functions of the part of the nose in which it is found. In the respiratory region it is columnar and ciliated. Interspersed among the columnar cells are goblet or mucin cells, while between their bases are found similar pyramidal cells. Beneath the epithelium and its basement membrane is a fibrous layer infiltrated with lymph corpuscles, so as to form in many parts a diffuse adenoid tissue, and under this a nearly continuous layer of small and larger glands, some mucous and some serous, the ducts of which open upon the surface. In the olfactory region, the mucous membrane is yellowish in color, and the epithelial cells are columnar and non-ciliated. They are of two kinds, supporting cells and olfactory cells. The supporting cells contain oval nuclei, which are situated in the deeper parts of the cells and constitute the zone of oval nuclei. The superficial part of each cell is columnar and contains granules of yellow pigment, while its deep part is prolonged as a delicate process which ramifies and communicates with similar processes from neighboring cells, so as to form a network in the mucous membrane. Lying between the deep processes of the supporting cells are a number of bipolar nerve cells, the olfactory cells, each consisting of a small amount of granular protoplasm with a large spherical nucleus, and possessing two processes, a superficial one which runs between the columnar epithelial cells and projects on the surface of the mucous membrane as a fine hair-like process, the olfactory hair. The other or deep process runs inward, is frequently beaded, and is continued as the axon of an olfactory nerve fiber. Beneath the epithelium, and extending through the thickness of the mucous membrane, is a layer of tubular, often branched glands, the glands of Bowman, identical in structure with serous glands. The epithelial cells of the nose, fauces, and respiratory passages play an important part in the maintenance of an equable temperature by the moisture with which they keep the surface always slightly lubricated. Vessels and nerves. The arteries of the nasal cavities are the anterior and posterior ethmoidal branches of the ophthalmic, which supply the ethmoidal cells, frontal sinuses, and roof of the nose. The sphenopalatine branch of the inferior maxillary, which supplies the mucous membrane covering the conchae, the meatuses and septum. The septal branch of the superior labial of the external maxillary, the infraorbital and alveolar branches of the internal maxillary, which supply the lining membrane of the maxillary sinus, and the pharyngeal branch of the same artery, distributed to the sphenoidal sinus. The ramifications of these vessels form a close plexiform network beneath and in the substance of the mucous membrane. The veins form a close cavernous plexus beneath the mucous membrane. This plexus is especially well marked over the lower part of the septum and over the middle and inferior conchae. Some of the veins open into the sphenopalatine vein, others join the anterior facial vein, some accompany the ethmoidal arteries and end in the ophthalmic veins, and lastly, a few communicate with the veins on the orbital surface of the frontal lobe of the brain, through the foramina in the cribriform plate of the ethmoid bone. When the foramen cecum is patent, it transmits a vein to the superior sagittal sinus. The lymphatics have already been described, page 695. The nerves of ordinary sensation are the nasociliary branch of the ophthalmic, filaments from the anterior alveolar branch of the maxillary, the nerve of the pterygoid canal, the nasopalatine, the anterior palatine, and nasal branches of the sphenopalatine ganglion. The nasociliary branch of the ophthalmic distributes filaments to the forepart of the septum and lateral wall of the nasal cavity. Filaments from the anterior alveolar nerve supply the inferior meatus and inferior concha. The nerve of the pterygoid canal supplies the upper and back part of the septum and superior concha, and the upper nasal branches from the sphenopalatine ganglion have a similar distribution. The nasopalatine nerve supplies the middle of the septum. The anterior palatine nerve supplies the lower nasal branches to the middle and inferior conchae. The olfactory, the special nerve of the sense of smell, is distributed to the olfactory region. Its fibers arise from the bipolar olfactory cells and are destitute of medullary sheaths. They unite in fasciculi, which form a plexus beneath the mucous membrane and then ascend in grooves or canals in the ethmoid bone. They pass into the skull through the foramina in the cribriform plate of the ethmoid and enter the undersurface of the olfactory bulb, in which they ramify and form synapses with the dendrites of the mitral cells. The accessory sinuses of the nose. Sinus paranasales. The accessory sinuses or air cells of the nose are the frontal, ethmoidal, sphenoidal, and maxillary. They vary in size and form in different individuals, and are lined by ciliated mucous membrane directly continuous with that of the nasal cavities. The frontal sinuses, sinus frontalis, situated behind the superciliary arches, are rarely symmetrical, and the septum between them frequently deviates to one or other side of the middle line. Their average measurements are as follows: height 3 cm, breadth 2.5 cm, depth from before backward 2.5 cm. Each opens into the anterior part of the corresponding middle meatus of the nose through the frontonasal duct, which traverses the anterior part of the labyrinth of the ethmoid. Absent at birth, they are generally fairly well developed between the 7th and 8th years, but only reach their full size after puberty. The ethmoidal air cells, cellulae ethmoidales, consist of numerous thin-walled cavities situated in the ethmoidal labyrinth and completed by the frontal, maxilla, lacrimal, sphenoidal, and palatine. They lie between the upper parts of the nasal cavities and the orbits, and are separated from these cavities by thin, bony laminae. On either side they are arranged in three groups, anterior, middle, and posterior. The anterior and middle groups open into the middle meatus of the nose, the former by way of the infundibulum, the latter on or above the bulla ethmoidalis. The posterior cells open into the superior meatus under cover of the superior nasal concha. Sometimes one or more opens into the sphenoidal sinus. The ethmoidal cells begin to develop during fetal life. The sphenoidal sinuses, sinus sphenoidalis, contained within the body of the sphenoid, vary in size and shape. Owing to the lateral displacement of the intervening septum, they are rarely symmetrical. The following are their average measurements. Vertical height 2.2 centimeters, transverse breadth 2 centimeters, antero-posterior depth 2.2 centimeters. When exceptionally large, they may extend into the roots of the pterygoid processes or great wings, and may invade the basilar part of the occipital bone. Each sinus communicates with the sphenoethmoidal recess by means of an aperture in the upper part of its anterior wall. They are present as minute cavities at birth, but their main development takes place after puberty. The maxillary sinus, sinus maxillaris, antrum of Highmore. The largest of the accessory sinuses of the nose is a pyramidal cavity in the body of the maxilla. Its base is formed by the lateral wall of the nasal cavity, and its apex extends into the zygomatic process. Its roof or orbital wall is frequently ridged by the infraorbital canal, while its floor is formed by the alveolar process, and is usually 1/2 to 10 millimeters below the level of the floor of the nose. Projecting into the floor are several conical elevations corresponding with the roots of the first and second molar teeth, and in some cases the floor is perforated by one or more of these roots. The size of the sinus varies in different skulls, and even on the two sides of the same skull. The adult capacity varies from 9.5 cubic centimeters to 20 cubic centimeters, average about 14.75 cubic centimeters. The following measurements are those of an average-sized sinus. Vertical height opposite the first molar tooth, 3.75 centimeters. Transverse breadth, 2.5 centimeters. Antero-posterior depth, 3 centimeters. In the antero-superior part of its base is an opening through which it communicates with the lower part of the hiatus semilunaris. A second orifice is frequently seen in or immediately behind the hiatus. The maxillary sinus appears as a shallow groove on the medial surface of the bone about the 4th month of fetal life, but does not reach its full size until after the second dentition. Footnote: the various measurements of the accessory sinuses of the nose are based on those given by Aldrin Turner in his accessory sinuses of the nose. End of footnote. At birth it measures about 7 millimeters in the dorso-ventral direction, and at 20 months about 20 millimeters. End of section 48.
Of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Read by Laurie Anne Walden. Anatomy of the Human Body, Part 4, by Henry Gray. The Organ of Sight. Organon visus, the eye. The bulb of the eye, bulbus oculi, eyeball, or organ of sight, is contained in the cavity of the orbit, where it is protected from injury and moved by the ocular muscles. Associated with it are certain accessory structures. These are the muscles, fascia, eyebrows, eyelids, conjunctiva, and lacrimal apparatus. The bulb of the eye is embedded in the fat of the orbit, but is separated from it by a thin membranous sac, the fascia bulbi. It is composed of segments of 2 spheres of different sizes. The anterior segment is one of a small sphere. It is transparent and forms about 1/6 of the bulb. It is more prominent than the posterior segment, which is one of a larger sphere, and is opaque and forms about 5/6 of the bulb. The term anterior pole is applied to the central point of the anterior curvature of the bulb, and that of posterior pole to the central point of its posterior curvature. A line joining the 2 poles forms the optic axis. The axes of the 2 bulbs are nearly parallel, and therefore do not correspond to the axes of the orbits, which are directed forward and lateralward. The optic nerves follow the direction of the axes of the orbits, and are therefore not parallel. Each enters its eyeball 3 mm to the nasal side and a little below the level of the posterior pole. The bulb measures rather more in its transverse and antero-posterior diameters than in its vertical diameter, the former amounting to about 24 mm, the latter to about 23.5 mm. In the female, all three diameters are rather less than in the male. Its antero-posterior diameter at birth is about 17.5 mm, and at puberty from 20 to 21 mm. Development. The eyes begin to develop as a pair of diverticula from the lateral aspects of the forebrain. These diverticula make their appearance before the closure of the anterior end of the neural tube. After the closure of the tube they are known as the optic vesicles. They project toward the sides of the head, and the peripheral part of each expands to form a hollow bulb, while the proximal part remains narrow and constitutes the optic stalk. The ectoderm overlying the bulb becomes thickened, invaginated, and finally severed from the ectodermal covering of the head as a vesicle of cells, the lens vesicle, which constitutes the rudiment of the crystalline lens. The outer wall of the bulb becomes thickened and invaginated, and the bulb is thus converted into a cup, the optic cup, consisting of 2 strata of cells. These 2 strata are continuous with each other at the cup margin, which ultimately overlaps the front of the lens and reaches as far forward as the future aperture of the pupil. The invagination is not limited to the outer wall of the bulb, but involves also its postero-inferior surface and extends in the form of a groove for some distance along the optic stalk, so that, for a time, a gap or fissure, the choroidal fissure, exists in the lower part of the cup. Through the groove and fissure the mesoderm extends into the optic stalk and cup, and in this mesoderm a blood vessel is developed. During the 7th week the groove and fissure are closed, and the vessel forms the central artery of the retina. Sometimes the choroidal fissure persists, and when this occurs the choroid and iris in the region of the fissure remain undeveloped, giving rise to the condition known as coloboma of the choroid or iris. The retina is developed from the optic cup. The outer stratum of the cup persists as a single layer of cells which assume a columnar shape, acquire pigment, and form the pigmented layer of the retina. The pigment first appears in the cells near the edge of the cup. The cells of the inner stratum proliferate and form a layer of considerable thickness from which the nervous elements and the sustentacular fibers of the retina, together with a portion of the vitreous body, are developed. In that portion of the cup which overlaps the lens, the inner stratum is not differentiated into nervous elements, but forms a layer of columnar cells which is applied to the pigmented layer, and these 2 strata form the pars ciliaris and pars iridica retinae. The cells of the inner or retinal layer of the optic cup become differentiated into spongioblasts and germinal cells, and the latter, by their subdivisions, give rise to neuroblasts. From the spongioblasts, the sustentacular fibers of Müller, the outer and inner limiting membranes, together with the groundwork of the molecular layers of the retina, are formed. The neuroblasts become arranged to form the ganglionic and nuclear layers. The layer of rods and cones is first developed in the central part of the optic cup, and from there gradually extends toward the cup margin. All the layers of the retina are completed by the 8th month of fetal life. The optic stalk is converted into the optic nerve by the obliteration of its cavity and the growth of nerve fibers into it. Most of these fibers are centripetal and grow backward into the optic stalk from the nerve cells of the retina, but a few extend in the opposite direction and are derived from nerve cells in the brain. The fibers of the optic nerve receive their medullary sheaths about the 10th week after birth. The optic chiasma is formed by the meeting and partial decussation of the fibers of the 2 optic nerves. Behind the chiasma the fibers grow backward as the optic tracts to the thalami and midbrain. The crystalline lens is developed from the lens vesicle, which recedes within the margin of the cup, and becomes separated from the overlying ectoderm by mesoderm. The cells forming the posterior wall of the vesicle lengthen and are converted into the lens fibers, which grow forward and fill up the cavity of the vesicle. The cells forming the anterior wall retain their cellular character and form the epithelium on the anterior surface of the adult lens. By the second month the lens is invested by a vascular mesodermal capsule, the capsula vasculosa lentis. The blood vessels supplying the posterior part of this capsule are derived from the hyaloid artery; those for the anterior part from the anterior ciliary arteries. The portion of the capsule which covers the front of the lens is named the pupillary membrane. By the sixth month all the vessels of the capsule are atrophied except the hyaloid artery, which disappears during the ninth month. The position of this artery is indicated in the adult by the hyaloid canal, which reaches from the optic disc to the posterior surface of the lens. With the loss of its blood vessels, the capsula vasculosa lentis disappears, but sometimes the pupillary membrane persists at birth, giving rise to the condition termed congenital atresia of the pupil. The vitreous body is developed between the lens and the optic cup. The lens rudiment and the optic vesicles are at first in contact with each other, but after the closure of the lens vesicle and the formation of the optic cup, the former withdraws itself from the retinal layer of the cup. The two, however, remain connected by a network of delicate protoplasmic processes. This network, derived partly from the cells of the lens and partly from those of the retinal layer of the cup, constitutes the primitive vitreous body. At first these protoplasmic processes spring from the whole of the retinal layer of the cup, but later are limited to the ciliary region, where, by a process of condensation, they appear to form the zona ciliaris. The mesoderm, which enters the cup through the choroidal fissure and around the equator of the lens, becomes intimately united with this reticular tissue, and contributes to form the vitreous body, which is therefore derived partly from the ectoderm and partly from the mesoderm. The anterior chamber of the eye appears as a cleft in the mesoderm separating the lens from the overlying ectoderm. The layer of mesoderm in front of the cleft forms the substantia propria of the cornea, that behind the cleft the stroma of the iris and the pupillary membrane. The fibers of the ciliary muscle are derived from the mesoderm, but those of the sphincter and dilatator pupillae are of ectodermal origin, being developed from the cells of the pupillary part of the optic cup. The sclera and choroid are derived from the mesoderm surrounding the optic cup. The eyelids are formed as small cutaneous folds, which about the middle of the third month come together and unite in front of the cornea. They remain united until about the end of the sixth month. The lacrimal sac and nasolacrimal duct result from a thickening of the ectoderm in the groove, naso-optic furrow, between the lateral nasal and maxillary processes. This thickening forms a solid cord of cells which sinks into the mesoderm. During the third month the central cells of the cord break down, and a lumen, the nasolacrimal duct, is established. The lacrimal ducts arise as buds from the upper part of the cord of cells, and secondarily establish openings, puncta lacrimalia, on the margins of the lids. The epithelium of the cornea and conjunctiva, and that which lines the ducts and alveoli of the lacrimal gland, are of ectodermal origin, as are also the eyelashes and the lining cells of the glands which open on the lid margins. End of section 49.